Hello everybody, this is Cyril Bourke. I'd like to share with you this week a look at the NES miHealth Outcomes Study document. This document you can find on the NES Health website under Science. If you go down below the Science tag, you'll find Clinical Trials. And this is where you can download this document. It's a PDF, it's small enough to email, you can share the link obviously with clients, and it can be used obviously to support your clients' understanding of what's possible with the NES miHealth, and obviously you could use it in marketing and promoting what you do. The study was done a number of years ago, but it's still very valid today, and I think you'll find that the statistics you find within it really do represent what you should be seeing in clinic. So let's have a look at the document. Well, the starting point is that it was a highly effective study. And right in front of us you can see the start of the document and the abstract from it. So the objective really was to see how effective the miHealth was when it was on body and off body and a combination of both, how long the treatments lasted, and what type of reactions people had. At the time, obviously, we were looking to see what type of negative events might occur. History now shows us that the results very much in the negative area were very small and were almost always a result of the client actually going into an active healing process. So sometimes we can misinterpret what shall we say, is a negative effect when in fact a healing process can feel negative because of the sensations involved. Most commonly drainage. This might be from the nose, through the bowel, through the bladder, through the lymphatic system, odours, things of this nature, senses of change in digestion, headache, things of this nature. They're all typically indications of the body starting a repair and detoxification process. So what did we find in the study? Well, if we look at the numbers, the number of people involved, we had 367 individual cases that were reported on. Of those, 268 were successfully completed and full follow-ups inquiries were done. Remembering that some of the study was carried on up to a year, so it's not such a bad figure that 268 completed. We lost around 100 patients, but a lot of those would have been resolved in the very first treatment or the follow-up treatments. They would have literally recovered. So the figures themselves show quite a good activity. Now, the exclusions criteria, as in those people we didn't use in the study, were people under the age of 18. We didn't have a top end age, so the age range was 18 and over. We didn't use patients who knew they were pregnant. We didn't use patients who had mental illness, and we avoided patients with pacemakers. Now, the results. Now, this first chart shows us the main issues at the time of the initial consult. So we can see very much that chronic pain was a very, very popular thing for people to come into the trial with. And you can understand why. The current medical system globally really doesn't cater very well for chronic conditions, and obviously that may have been a reason why we had a bountiful supply of chronic pain patients. We did also have acute pain. Obviously you can see the chart in front of you: joint pain, muscle, nerve, stress of a whole range, skin issues, energy issues, digestion, bone issues, and general rejuvenation, beauty, sleep, memory, hearing, and incorrect data being recorded in the group as well. Now, looking at the next chart, you can see the percentage of positive effect of the first session. So this is the initial session when a patient comes in and provides us with their condition. So in this state you can see sports injuries went down very well, an extremely high level there in the upper 90% with a first positive response. Muscles, etc., down to more chronic conditions also came in at a very high value in the mid to upper 90%. So in this initial treatment people were seeing big changes. We see the numbers drop into the mid 80% as we look at joints and then acute pain, nerve, energy, and this is people, you know, saying they have very low energy levels, etc., and really looking to be pepped up and really feeling brighter and more energetic. Now, longer term problems like digestion, we were still seeing changes of above 80% in the first treatment, along with stress, skin conditions, which are notoriously difficult to treat. They were still seeing changes in the upper 70% in the first treatment, and bones, so these are conditions where the bones are indicated, still above 60% in the very first treatment. So really, what type of changes are we looking at? Well, basically, if we were to try and see what the common factor was across all of these areas, there would be forms of inflammatory response that are obviously causing pain, and the miHealth device was having a direct impact on pain in that first treatment. So let's look now at the next chart. Let's look at the first chart here. So we have acute pain. Now in this chart it represents 58 patients. Now of those 58 patients, 36 of them required follow-up treatment, but in that first treatment 47, almost 48% of them had a significant change in pain. We're looking at values here, average pain relief somewhere around 40% and above. Now when they repeated the treatment, we were getting values of somewhere around 73 to 74% improvement. So the first treatment almost 50%, and then after that it got better and better. So it's definitely worth reminding patients that a one-off treatment is only the start of pain relief, when you have to maybe redirect energy and get the body to follow its own healing process. If we look at the muscle issues, we had 34 patients for this, and again very similar initial treatment values, somewhere very close to 50% pain relief, and when they followed up, that also provided an extremely good almost 70%, that's 68.53% on a follow-up. So again, whether it's just pain or functionality of muscle, they were getting big benefits by repeating the treatment. If we look in the chronic area, which was the largest group of patients, we've got 123 patients who were treated initially for chronic pain. 90 of them had follow-up treatment. And again, we're looking at very high initial treatment values of relief, 47% relief, and on a follow-up, or should I say a second treatment in this case, they were still looking at 66%. So again, that shows us that the initial treatment has a big impact, and following that up again with the second treatment really does improve the values quite significantly. Now when we're looking at stress, and this is obviously based on the client's perception of stress, we're looking at almost a 50% relief from the patient from stress within the first treatment. Now the follow-up treatment again was giving them somewhere around 63% change, and these figures are pretty significant when it comes to stress values. Now below that, energy issues, we can see that around 40% improvement in energy issues, and when repeated again somewhere around 66% improvement when the treatment was repeated. joint pain, we're looking at values here that 54% in the initial treatment, and that was a repeat treatment, bringing people close to 65% recovery within those early treatments. So the first treatment was bringing people between 40 and 50% relief, and then after that people were looking at 60 and above 60% reduction in discomfort. And when we're looking at numbers that are quite significant in the numbers of people taking part, these values are statistically quite important. Gen rejuvenation, so we're looking at people's general conditions. Again, first treatment, people were looking at about 50% improvement, and then repeating those treatments, bringing them to around 71-72%. Digestion issues, this is a slightly less improvement on the second treatment, but it's really showing us that you can get dramatic changes in the first treatment. 54.5% change in perception of discomfort, and the follow-up treatment provided around 57-58%. Now these values really are big changes. To be able to get that sort of change in the first treatment and then to see a significant change again in the follow-up is really quite wonderful for the clients. I mean, this could answer a lot of questions when clients ask you what types of changes might occur. Now the chart we have in front of us is looking at the percentage of patients repeating the treatment. Now in the chronic and acute pain areas, we're looking between 70 and 60% of the patients chose to have repeat treatment. And as we can see by the results we were looking at earlier, that second treatment was really making a big difference. Joint pain, muscle pain, nerve pain, all of these patients are choosing to repeat the therapy and getting significant changes. The lowest values there we're looking at were the muscle pain people, who maybe around 35% of them chose to have a repeated treatment. Most commonly I would expect that is because in the first treatment their changes were so significant they didn't actually feel they needed a follow-up, which is a wonderful way to be. Now in this chart we can see the number of patients who continued for certain periods. So obviously the largest group of around just over 140 were in the trial for a year. And then we have around 60 people who are in less than a year, and as you can see the values go down from there off to the right. Now obviously a lot of people with chronic conditions, they would have had their conditions obviously a lot longer than the acute people. It does show that the acute responses are faster, but we still did get significant changes for the chronic clients. Let's have a look at the chart below this to see the average pain relief issues and the improvements. So if you look at the values here, we can see that the blue are the initial consults, and the average pain relief in percentage to the left, and then over a period of time what was the change, so to speak. So an initial response for the patients who were in the trial a full year, they had about 43% change in the first treatment, and then after repeated treatments they went to around 60%. So in their case it may have been a year to get to 60%. If we look at those who were in the more acute range of things, we can see that someone in 1 to 2 days was going from a 60%, 62% change on the right hand side of the chart through to 76% change in that follow-up. So in having 2 treatments in a couple of days for the very acute people really made a massive change. And then you've got where most clients are between maybe 1 and 3 months or so, where in the initial treatment they had between 50 and 35% change, and then in the follow-up where they had repeated treatments over those periods, they went between 60 and 71% change in pain levels or rate of improvement. As you can see on this chart then, the patients who needed repeat treatments obviously stayed with the trial for up to a year, and those patients who got faster results, they didn't need as many repeat treatments, and as you can see, the people that had 1 to 2 days, only about 50% of them needed follow-ups. Now the chart we have in front of us is looking at the actual miHealth functions used. So these are the ones that you find built into the miHealth device. And at the time they weren't using energetic rejuvenators, so there was no prescription, so to speak, from the Nest software directing exactly into the miHealth, telling you which ones to use specifically. So symptomatic response was obviously one of the main tools that people were using, as in inquiring with a patient, monitoring it, and making choices related to, in this case, mainly the physical folder. So the chronic balance was used very consistently, and then we have BioCell, general rejuve, acute balance, and as you can see them working all the way across to the right hand side. Things like sleep and memory, etc., were obviously quite specific to certain people's complaints, particularly if you're looking from a symptomatic point of view. But the bulk of pain, discomfort was addressed between, shall we say, muscles, acute, general, rejuve, BioCell, and chronic balance, and they're obviously a good starting point for any treatment there. Now this is a question that often comes up with practitioners as to the amount of on-body and off-body. Well, you can see right here on the chart, the off-body was providing about 20% of the treatments. On-body was over 50% of the treatments, and then there was a combination which took up the rest of around 25% or so, where people were using a combination of both on and off-body. For the purposes of the trial though, those that were off-body, in the initial treatments they were getting somewhere very close to 50%, 48.45% improvements, and when they went to repeated off-body treatments, that was still going to almost 60% relief at 58.77, and that's a very significant value. The on-body treatments, we're looking at about 45% on-body in the initial treatment, as in relief, and the repeated treatments brought them to almost 65% at 64.67. So the values weren't that much difference between on and off body, and when people combined on and off body, the repeated value brought them very close to 70% at 68.4. So it showed that combining did have an edge, but using either on or off body, people were still getting very significant treatments and results. Here we're looking at the relationship of time against results. So patients who had a 1 to 10 minute initial treatment were getting somewhere around 45% improvements. When that was followed up, they were still getting very good results, somewhere close to 70% in the upper 60%. Treatments that went over 10 minutes in the initial treatment were very similar to the 1 to 10 minutes. Just a fraction less on the numbers here, and repeated treatments again when it was between 10 and 29 minutes, they were getting longer therapy, and the values were somewhere around 60%. Now these figures may be affected by the fact that the results were needing a little bit more time. You find if somebody's being treated for 1 to 10 minutes and they're getting a good result, that's a good time to just pull back on the treatment and say, okay, let's test you now, let's see what's happening with you. And obviously the group in the middle, the 10 to 29 minutes or 11 to 29 minutes were needing more, and the therapist treated more. Their conditions may have been more severe, but we can still see that they the type of results they were getting. Now, the patients who were treated for 30 to 90 minutes, and that's quite a big section there, they were getting much stronger initial changes, and their follow-up values were significantly higher in the upper 70%. So in the bulk of those treatments, we were getting very, very great results. So I think the rule of thumb for your client is keep monitoring them during treatment. Check every few minutes to see their condition and see if you're still in the most appropriate location or working in the right areas. You'll be surprised how quickly something can change in a couple of minutes, and there's no need to carry on keep treating in that area. Test them and ask what's next. Where is the pain moving? Where is the function changing? And you'll find you can chase the condition and get faster results. Don't find yourself in the situation that potentially could leave you acting like a massage therapist, just treating without observing the changes. Please make sure you do that, because you'll rapidly improve the results you're getting if you're just treating without checking. Here we're looking at the relationship between the pain or strength of the issue. So in this case, left hand side, we're looking at the initial treatments for weak, strong and very strong pain, and the values 2 to 5, 6 to 8, 9 and 10. These are the type of values you'd see on a visual analog scale. That's the chart that you may be using with your clients already, often referred to as VAS, visual analog scale. If you don't have one of those, please download one from Google. There's lots of versions. They're very effective in helping someone judge for themselves where they're at, and allows you to record the type of values that you're looking at. So here we go. We've got the weak to mild, middle strength pain. In the initial treatments, 45%, 44.92. And then that was improved to almost 65% on a follow-up. The strong pain, 6 to 8 on the visual analog scale, gave us a 46 to 47% in the initial treatment, and a repeated result was providing us around 60 to 62.26% there. And those patients who were in a lot of pain were still getting very good changes in the initial treatment, and their follow-ups were also providing very high values there. As you can see, it goes from 46% in initial treatment to 66%. So it almost didn't matter what level of pain a patient was at, percentage-wise, they were still getting significant changes with a miHealth device. Here we're looking at the different areas of the body that patients were coming in with conditions. So these are their focal points, so to speak. So we're looking at thoracic and stomach areas, the head, the arms, the legs, and the back in general. And it's quite a wide spread there. So we've got the thoracic and stomach area. 54% of the patients came in, and this is also included in the repeated therapies. Head, about 40%, 41%, and again in the repeated areas it came up to 64%. This might be related to conditions moving around the body. It could also be related to patients being conscious of drainage processes and detoxification, and the body resetting other systems. The arms and legs started at 32% for initial treatment, so this is the reason people came in, and in the repeated treatments it went up to 65%. So you might find that the body was let's say they came in with a spinal injury or a spinal problem or a neck injury, and that might have been their first initial treatment, and as that's treated then they're more conscious of other areas such as the arms and the legs, etc. And the back in general, 47% as a starting point, and then 62% as a repeated area. So again, it may have been the focus for the bulk of patients after repeated treatments. That was the area that they really felt they needed more help with. Now this area looks at the age-old question, does the effective treatment last? Now I guess our way of measuring that is, how did the clients respond to, is the treatment helping them? Are they seeing changes? Are they progressing? So out of the initial treatments, we had a positive effect, as in the patients definitely were certain that they were getting a good response and improvement out of the initial group. We've got 323 that say yes, that was definitely a positive event. There was, in the initial group, no effect on 33%, so around 10% of the people believe that there was no effect, as in they were not certain of the change. And then we had a negative effect of around 11 people. There we go, 11 people. So out of almost 400, 367 I think we started with, 11 people felt they had a negative effect, and that would have to be looked into detail to see whether we were actually seeing new conditions and problems, or whether we were looking at potentially the body going into repair processes. And this is something as practitioners you'd be looking strongly at to see. Now on repeated treatments, we're looking at 238 people believed they had a good solid positive effect, remembering that not as many people went into the repeated treatment because the first treatment was so effective they didn't need to come back for a repeated treatment. Hence we've got lower values there in the repeated area. No effect, about 12 in the repeated area, and a negative, we were down to 2 at that point. Now we've got initial consultations of 367, and that really is a significant number of people, a good cross-section of clients. Of positive effect, around 88% of the clients who took part in the initial study. Negative effect at around 3%, and no change in around 9% of the clients. So as practitioners, that would be a very, very nice number of figures to work with if that was your client base. Now the average improvement before the next therapy was seen at around 25%. Obviously some clients saw huge changes and others saw much smaller changes, and that's where that average comes together. I hope that's been helpful for you to understand the type of information that's in this document, and being able to make it available for your clients, and being able to explain to them what type of things were looked at, what range of conditions. This will help you be able to justify whether the conditions your clients are coming to you with have a, shall we say, a sensible view of change. And I hope this helps you in your clinics and helps you support your clients and helps your clients bring more clients to you. Again, don't forget that the whole report is available on the miHealth website, and you can find that under the science section of clinical trials. Right, have a very good week.